Awesome people, today we are going to see how to analyze a CSF report in a suspected meningitis case. I am Jay for Medicosum. First of all, let's see the normal values in a CSF report. We have three major parameters where we will see WBC or cell count and sugar count and the protein count. The WBC or cell count should be less than 5. All of which should be lymphocytes. We are not expecting neutrophils in a normal CSF report. The next one is sugar. They should be 50% of the blood glucose level. Blood glucose level. Some people and some books, some authors say this 50% could be 60% or a little bit less than 50%. So for very accurate and to know what your hospital is following, just refer to your national guidelines. For protein, we are going to notice that 40 milligrams per deciliter is normal. So up to 40 milligrams per deciliter is considered a normal value. So again, WBC and cell count should be less than 5 and all of it should be lymphocytes, then 5, then 50. Sugar should be 50% of the blood glucose level. So blood glucose, let's say 120. Then the CSF should be at least 60. Okay? Okay. So the protein should be 40. So 5, 50, 40. That's how I would like to remember the normal values. So let's go to how to rate a CSF analysis report. We have three major organisms which causes meningitis and we can catch them in a CSF analysis report. Viral, bacterial and TB. These three will have unique differences when it comes to our parameters, the WBC, the protein and the sugar. So in viruses and in bacterials and in tuberculosis bacteria, I would like to introduce you a very easier way to remember, where I would like to think the viruses as very small particles of protein who do not like to eat sugar, and the bacteria would be a bigger protein molecules who likes to eat sugar, and the TB are very huge protein molecules who have a sweet tooth, so who would like to eat a lot of sugar. So if we are going to substitute this story into our report, we are going to see that the viruses will have a small rise in protein because they are small proteins, right? So these proteins added into the CSF would cause a little bit of a rise. Or sometimes they have very negligent amount, like very little protein, so it may also be normal. And these guys do not like to eat sugar, so sugar level is going to be normal. The bacteria, how did we see them? The bacteria are a little bit big proteins, so we are going to see an increase of proteins when they are added to the CSF. And the bacteria like sugar, like to eat sugar. Not as much as TB, but they like to eat sugar. So our existing sugar level will go down, right? Okay, so TB, the biggest protein molecules in our story, the biggest protein molecules, so they will increase our protein count a lot. And they have a sweet tooth, so they're going to eat a lot of sugar, so our sugar count will go very low. Do you understand how easy that is? Okay, so next, we know that viruses induce lymphocyte increase in our blood. So the same is true for the CSF as well. Our existing lymphocyte count will increase. The bacteria will induce neutrophil count. So if you are going to see some neutrophils in CSF report, that's going to give you a huge clue that this could be bacterial. And TB, the TB boy is going to induce lymphocytes. Although that's a bacteria, it's going to induce lymphocytes. So it's going to induce lymphocyte predominance. All these three I'm going to say that this is lymphocyte predominant, this is neutrophil predominant, and this is lymphocyte predominant again. So does that mean that we will not see others? I mean, we will not see the neutrophils? No, that's not what I mean. We will see them, but that won't be as higher as the predominant cell type. Okay, so how do you find this? Is it easy or is it hard? This story is very easy for me to remember. So that's why I thought to teach you all how to read a CSF analysis using this little story. So if you think it helped you, please give a thumbs up and subscribe to our channel. And if you have already subscribed, please hope for better and more videos in the future. Thank you and see you later. Bye. Take care.